Pericardium is a fibroserous sac that encloses the heart and root of great blood vessels. The pericardium, it lies within the middle mediastinum, posterior to the body of sternum, and the second to sixth intercostal cartilages, and anterior to the fifth to eighth thoracic vertebra. Functions of the pericardium are to restrict excessive movements of heart as a whole and serve as a lubricated container in which the different parts of heart can contract. The pericardium is divided into the fibrous pericardium and the serous pericardium. The fibrous pericardium. Fibrous pericardium is a strong fibrous part of a sac. Fibrous pericardium attached in front to the sternum by the sternopericardial ligament and is also attached below to the central tendon of the diaphragm. It also fuses with the outer coat of great blood vessel passing through it, the aorta, pulmonary trunk, superior and inferior vena cava, and pulmonary veins. This is how this is seen in the real cadavers, the fibrous pericardium, which is the outer covering of the heart, which is thick and tough. Second layer is the serous pericardium. Serous pericardium, it lines the fibrous pericardium and also it coats the heart. Divided into the parietal and visceral layer of the serous pericardium. Parietal layer of the serous pericardium, it lines the fibrous pericardium which is reflected around the root and great vessels to become continuous with the visceral layer of serous pericardium closely in contact with the heart. The visceral layer of serous pericardium is closely applied to the heart and is also called as the epicardium. After dissecting the fibrous pericardium, we can see the serous pericardium, which is the inner wall of the fibrous pericardium, which is a smooth in appearance. The pericardial cavity. Pericardial cavity is a slit-like space between the parietal layer and the visceral layer. It is normally the cavity containing a small amount of tissue fluid or the pericardial fluid which act as a lubricant to facilitate the movements of heart. The fluid is around 50 ml. This is how the serous pericardium looks like. It is the inner layer of the serous pericardium, that is the visceral layer. In this diagram, we can see the outer covering is the fibrous pericardium, then is the serous pericardium made up of two layers, that is parietal pericardium and the visceral pericardium. The visceral pericardium, also called as the epicardium, which is one of the outermost layer of the heart, that is epicardium, myocardium and endocardium. Endocardium indicated by the black line in the diagram, and also the pericardial cavity which is in between the visceral pericardium and the parietal pericardium. Inferiorly there is diaphragm and the central tendon formed by it. Pericardial sinuses. There are two sinuses of pericardium, that is oblique sinus and a transverse sinus. These pericardial sinus form during the development of heart as a consequence of folding of primordial heart tube. They have no clinical significance. The oblique sinus. Site of the oblique sinus is posterior surface of the heart which lie behind the left atrium. It is also a blind recess formed by the reflection of serous pericardium around the large veins, that is left pulmonary vein and the inferior vena cava. Second sinus is the transverse sinus which lie onto the posterior surface of heart and is a short, wide passage lying posterior to ascending aorta and pulmonary trunk, anterior to the superior vena cava and superior to the left atrium and pulmonary veins. Nerve supply of the pericardium. The fibrous pericardium and parietal layer of serous pericardium, they are supplied by the phrenic nerves. Visceral layer of the serous pericardium, they are supplied by the branches of sympathetic trunks and the vagus nerve.